cat's eye. That's it.
Are you still?
What is? Look, I got one of these.
What? Stop. Stop.
Dude, that was so painful when they transferred me from this table to the freaking X-ray board.
So how many X-rays did you get?
3 or 4.
3 or 4? Can you remember?
I don't know.
Okay.
He like burns right now with that on in his fedora. Burns this thing with
Oh my
They
god,
had to
burns. Oh gosh!
do one from behind and out, and then also they took one of my ribs just to make sure.
Okay.
You don't want to know.
We'll find out shortly if you're broken.
Let's pray not.
If it's just a bruise, you're paying for my lifting.
Yeah. You guys are cheapskates.
I'm just kidding, dude. I honestly.
If this is a bruise, this is a seriously bad bruise.
I almost made a boo-boo. What? We're not elaborating why you're filming. Duh.
I don't even know what you're talking about, so we'll leave it at that and move
I'll
on.
tell you later.
Okay.
Tell me later?
No.
Shit. Sit on my face.
Sit on my face.
No, you got it. He says, "Murr."
Sorry.
Sit on my face.
Same chick in the gurney, just with that.
That one?
No, I can't. I can't see face there. I can only see body. You know what I mean? I'm like without glasses, I'm useless at this. In the bathroom card. just go back.
I appreciate you staying with me, man.
Let's go see it.
Well, the toilet was flush.
How's your pain?
I'm good, okay?
She's back.
Back up again, or what number would you give it?
I mean, I'm doing okay right now.
Do you want to hit it up a little bit?
Actually,
No?
I like it better
Okay.
flat.
Okay. So let's see what's going on with that X-ray. So you don't want any more pain medicine?
Take what you can get.
Yeah, I'll go ahead and take some more.
Did you get that on video? He said, "You're like." She turns around.
And yes, Clark, I did get you masturbating in front of the nurse.
We were waiting for the chick to come out of the bathroom in the gurney, and I saw her ass as she went past. She went and grabbed to close it up, right? But I was fast enough.
Wait.
Huh?
You saw it?
I saw it. Her ass, not it.
In the name.
I'm like, I saw it really quick. He stopped like 2 seconds before she walked up.
He didn't stop. He skipped your feet.
It took my brain a minute to recognize that there was
It was
someone
a
in
good
front of me.
second where you're like, "Oh shit!" His brain and his.
I was watching the door. She came in my peripherals. I have natural horse blinds.
You're an idiot. I gotta pee.
He's gonna pee. Whatever. He's gonna go in there and like kiss the pussy. He's like, oh. Give me water. Put that on Bossman. Come on.
I was documenting you masturbating to a chick that's in the hospital. So 3 X-rays, 4 cc's of morphine, and 1 horrendous fall later. Here we have Boswick.
Yeah, no,
Okay, more medicine. What number is your pain at? You know the old 1 to 10 scale? 10 is somebody's cutting off that leg.
It's about 7.
probably have to amputate.
5.
We're gonna call you Bob.
Look down so your arm can
Yes,
like move around
please.
a little bit. You didn't get nauseous from this medicine, right?
Go to the trash.
Now, I'm not sure who's coming in at 3. It'll either be Bastian will be your nurse or Janice.
Okay.
And I'd like to get the doctor now to read that x-ray. See what's going on.
Watch, if you want me to get on there with you and we could spoon and make you feel better.
No.
I'm insulted.
You want to spoon with
You
Christine?
don't want to spoon with me, okay.
No spooning?
No spooning.
Did they see the x-rays yet?
He should be able to come in and show you. We have a portable thing.
Oh, they have to like print them or?
Well, no, they just have to be read by the radiologist, so that's usually, I mean, the regular doc can kind of look and see, but we wait till the radiologist gives an official reading. So before I leave, I'll check on that. You just got 4 more.
I felt that one.
I think you know it. Yeah.
I think you know it. So
Okay.
How you feeling, Boswick?
Oh, it's gonna be
Oh,
good.
here we go.
Oh, great, you got it. What did we see?
You're busted.
Oh, shoot.
Oh,
Oh, gosh.
God.
Oh, she.
Okay, what do we have here, doctor?
Right there.
Oh.
Split, right?
Femoral neck fracture.
Oh, shoot.
Does it need
I
surgery?
wonder why you're in pain.
Yes.
Poor guy.
To do what?
So, sir, what did you call it?
This is a femoral neck fracture.
Okay.
The neck of the femur, basically shaft of the femur, trochanters where the large muscle groups of your thigh attach. Basically, the neck is here. The head articulates in the acetabulum of the hip, and basically this break is essentially across.
What do you have to do in surgery to like just?
So, what will it
Screws
take
and
for him to be okay again?
Surgery.
He needs screws in his leg, correct?
Hardware. Yeah.
Yeah.
Oh.
Yeah.
Ah,
And there are a number
Poor guy. Don't
of
worry.
different kinds of hardware that the orthopedic surgeons use depending on the architecture of the fracture, if you will. So
So will he be doing that here, or we need to take him back home to get him in the hospital maybe?
Yeah, we're confused on this one.
yeah,
Or
I
from Saratoga Springs.
right. I have to say that the ortho guys here do as much orthopedic trauma as anybody in the country.
Skiing. 'Cause
Yeah,
the mountains,
we're
yeah.
the closest ER to the 2 largest ski areas in Vermont. And so
Okemo,
these guys
yeah.
see more ortho trauma than
Yeah.
most groups
Definitely, yeah, it definitely
combined.
makes sense.
So,
Nothing
and the guy who's on, Dr. Marsh, is a wizard. I would have no hesitation if I had a broken bone of having Dr. Marsh
Oh,
work
he's
on me.
excellent.
Yeah.
Excellent guy.
So
I
when
would have
will he
my
be
own
going
kids.
into surgery?
It depends a little bit on what's going on in the operating room now. You're a young, robustly healthy guy, so there are no medical reasons that would need evaluation in terms of getting you to surgery. So it really is more a matter of
When
who's-
surgery's ready, basically.
exactly who's on deck in the operating room in terms of other patients that are already there.
I have a question here. This is all the femur right here, correct? All through
Yes.
this area?
Yeah.
And, okay.
You see where the
So
break is?
technically, he broke his
Yeah.
femur, correct? And he didn't
Yes,
break
correct.
his hip. He broke
Correct.
the femur, okay.
Yeah.
You're just like Vance.
Yeah, one of my roommate actually just broke his femur, but he broke it down at the knee, basically. He fell off a motorcycle, flipped in front of the motorcycle, and hit a guardrail, and then the motorcycle hit his leg.
That'll do it.
So, do you think you will be going into surgery today?
I can't say. I'm not the surgeon.
Okay.
So, but
How long do you think it will take after surgery for him to leave the hospital?
Yeah, that's... And we're sorry this is all on camera. But,
usually people are in the hospital for several days.
really.
You know, yeah, the
Because Wes, my friend who broke his femur, was 5 days in the hospital.
right.
Or 4 days.
Yep, depending on a number of things, but the surgery itself is a relatively straightforward procedure, and Dane is a robustly healthy guy.
Yeah,
so
that helps.
yeah, it helps a lot. I suspect that phone call is the ortho group, so let me take this. Actually, I can leave this, and I'll come back and answer any questions and
Okay.
Thank you,
tell
sir.
about the story.
Thank you very much, sir. I'm sorry, Dane. Seriously.
It's alright.